Hello.
Yes, ma'am.
हेलो, आवाज आ रही है
Slide,
मेरी?
यस मैम
slide
आ रही
show
है।
रही है? Slides.
यस मैम हो रही है मैम।
ठीक है.
Yes, ma'am.
Today's lecture topic is about the trachea and the bronchi. So let's start with the trachea. The trachea is in continuation of the larynx, and it starts at the level of the lower border of the cricoid cartilage. That is an anterior demarcation for the extension of the trachea. And posteriorly, it lies at the level of the sixth cervical vertebrae. So always there is a landmark when we describe the extension or continuation of any structure. So for the Ji Habibullah.
मैम वेटिंग वालों को अलो करें।
अच्छा, जो वेटिंग वाले हैं ना उनको कहें कि वो वेट ही करते रहें जब तक वो अपना ग्रुप और आईडी या जो भी आपका है रोल नंबर मेंशन नहीं करेंगे। तो अभी तक अगर आपको ये बात नहीं समझ आई है तो भले वो वेटिंग में ही रहें। The trachea is a continuation of the larynx. It starts at the level of the cricoid cartilage, and posteriorly, that is the level of the sixth cervical vertebrae, C6 vertebrae. The trachea ends at the level of external angle, where it divides into two main bronchi, the right principal and the left principal bronchus. That is known as the extension of the trachea. The trachea is a cartilaginous and membranous tube, contains the hyaline type of the cartilage, and it is also contains a trachealis muscle. It is about 11 to 12 centimeters long and 2.5 centimeters in diameter. See in this figure, that is an extension of the trachea. The trachea is a continuation of the larynx at the level of the cricoid cartilage. This is the cricoid cartilage.
मैम
जी फरमाएं।
मैम अगर आप उर्दू में मैम थोड़ा इंटरेस्टिंग लगता है टॉपिक, अगर आप उर्दू में थोड़ा बता दें तो।
देखें ताशफीन, फर्स्ट ऑफ ऑल योर मोड ऑफ इंस्ट्रक्शन इज इंग्लिश। ठीक है, तो आप अपनी इंग्लिश को इम्प्रूव करें बजाय इसके कि आप मुझे ये कहें कि मैं आपको जो है वो उर्दू में समझाऊं। आपकी बुक्स किस लैंग्वेज में लिखी हुई हैं?
मैम वो पढ़ने में आसानी होती है फिर उधर से, अगर
हाँ, तो
उर्दू
आप
में समझ
दोबारा
में।
से जो है वो इंटरमीडिएट करें।
ठीक है मैम,
जी बिल्कुल। अब फिर आप लोग बात करते हैं आपके लेवल की कि इज इट अ लेवल ऑफ एमबीबीएस फर्स्ट ईयर एमबीबीएस स्टूडेंट्स और नॉट। स्टैंडर्ड जो आपकी यूनिवर्सिटी में जब आप लोग आ जाते हैं, दैट इज एन स्टैंडर्ड लेवल फॉर द एजुकेशन ऑल ओवर द वर्ल्ड। आपकी जो बुक्स फॉलो की जाती हैं वो कीथल मोर है, आपकी जो है स्नेल है, एंड ऑल दे आर इन द लैंग्वेज ऑफ इंग्लिश। तो अगर आप कह रहे हैं ठीक है कुछ चीजें हैं जो मैं आपको दोबारा से समझा सकती हूँ, लेकिन ऐसा नहीं है कि आपका जो है पूरा लेक्चर उर्दू में होगा, ऐसा तो बिल्कुल नहीं हो रहा कुछ भी। तो अपने स्टैंडर्ड और अपने लेवल को जो है हाई करने की कोशिश करें। हमें जो है और लो लेवल पे नहीं, ऑलरेडी आपके लिए जो ना वो बहुत लो लेवल है, तो इससे ज्यादा तो और लो नहीं जा सकते हम। We are discussing the trachea, that is an one of the content of the respiratory system. That's main function is to conduct the air from the larynx to the different parts of the respiratory tree. Related to its extension, it extends from the cricoid cartilage, that is one of the cartilage of the larynx, and inferiorly it ends at the level of the external angle. The part of the trachea at which it divides, this part is known as carina, where it divides into two main bronchi, the right and the left principal bronchus. If we see the structure of the trachea, that is mainly composed of U-shaped rings of the hyaline cartilage. Posteriorly, there are the free ends of this because it is a U-shaped or C-shaped. So C-shaped cartilages, posteriorly, these are the free ends. And these free ends are connected by a type of smooth muscle known as trachealis muscle. So the main structure of the trachea composed of two structures, the hyaline cartilage that is arranged in C-shaped or U-shaped rings. You can easily see in this figure. And posteriorly, these ends are connected by a type of smooth muscle known as trachealis muscle. When the trachea starts in the region of the neck as in continuation of the larynx, and then it extends into the thoracic region and lies in the superior mediastinum. So there are two parts of the trachea. The part that lies in the region of the neck, and when it enters into the region of the thorax and lies in the superior mediastinum, that part is known as thoracic part of the trachea. So the important relations of the structures with the trachea is also divided into two parts. The relations of the trachea in the region of the neck, and then the relation of the trachea in the region of the superior mediastinum. And all these relations are important clinically in the cases of any damage to the trachea when we use a different procedure for the trachea in the region of the neck. They are divided into anterior relations, posterior relations, and the lateral relations. That structures lies anterior to the trachea are the most superficial structure is the skin. After reflecting the skin, there is the fascia. Then there is an isthmus of the thyroid gland. Now, say in this figure, the two structures are reflected in this figure, the skin and the superficial and the deep fascia. After that, this part of the thyroid gland is known as the isthmus part, which connects the two lobes of the thyroid. This part is known as the isthmus of the thyroid gland that lies in front of the trachea. The third structure is jugular arch. The jugular arch is a type of venous arch which connects the two anterior jugular veins. Another structure lies in the anterior relation is the left brachiocephalic vein. You can also see in this figure. This is the left brachiocephalic vein lies in front of the trachea. And there are two muscles, the sternohyoid and sternothyroid muscle. These are the muscles of the neck region. The structures present in front of the trachea in the neck region are the most superficial structure is the skin. After reflecting the skin, then there is a fascia that present throughout the body. In the region of the neck, again, these two structures are important and more superficial structure. After reflecting the skin and fascia, then there is an isthmus of the thyroid gland, the central part of the thyroid gland known as the isthmus. Then inferior thyroid vein. Inferior thyroid vein, see in this figure, this is the inferior thyroid vein that drains into the left brachiocephalic vein. So left brachiocephalic vein also present in front of the trachea and the anterior relation. The other structures are sternohyoid and sternothyroid muscle. This one is the sternohyoid and this is the sternothyroid muscles. In the posterior relation, the main relation is esophagus, and along with the esophagus, the recurrent laryngeal nerves, the right and the left recurrent laryngeal nerve. See in this figure, the most important posterior relation of the trachea is the esophagus. Along with the esophagus, the recurrent laryngeal nerves, the right and the left recurrent laryngeal nerve. On the lateral sides, on the right and the left sides of the trachea, there are lobes of the thyroid gland along with the carotid sheath and its contents. So these are the lateral relations of the trachea, the lobes of the thyroid gland, and these are the contents of the carotid sheath. The carotid sheath is a type of the fascia, the deep fascia that covers these structures. The neurovascular bundle contains common carotid artery, internal jugular vein, and the vagus nerve. These structures lies within the carotid sheath. So now collectively, the anterior relations, posterior relations, and lateral relations of the trachea in the region of the neck. Anteriorly, first structure is skin, then fascia, then the isthmus part of the thyroid gland, inferior thyroid vein, and left brachiocephalic vein. along with the jugular arch and the two muscles, sternohyoid and sternothyroid muscle. In the posterior relation, main structure is esophagus along with the recurrent laryngeal nerves, right and the left recurrent laryngeal nerves. In the lateral relations, there are lobes of the thyroid glands, and the carotid sheath contains three structures: internal jugular vein, carotid arteries, and vagus nerve. Now the relations of the trachea and the superior mediastinum. When the part of the trachea it enters into the superior mediastinum, there are also different relations at this point. Anteriorly, because anterior boundary of the superior mediastinum is formed by the manubrium part of the sternum. So first superficial structure is manubrium part of the sternum. Then the thymus, that is one of the content of the superior mediastinum. Left brachiocephalic vein, the arch of aorta and origin of its two main branches, the brachiocephalic and the left common carotid. Now see in this figure, this is the part of the trachea in the region of the superior mediastinum. So the first most superficial structure is manubrium part of the sternum. After we reflect this part, then there is a thymus. That is one of the content of the superior mediastinum. In the vessels, the left brachiocephalic vein, the arch of aorta, and the origin of its two major branches lies in the anterior relation, the brachiocephalic trunk or brachiocephalic artery and the left common carotid artery. In the posterior relations, again, the esophagus from the neck region also enters into the superior mediastinum and lies in the same relation in the posterior relation to the trachea along with the left recurrent laryngeal nerve. In the right-sided relations, there are azygous veins of the right vagus nerve and the right side of the pleura. At this side, on the right side of the pleura, the right aspect of the pleura, along with the right vagus and the azygous veins. On the left side, there is arch of aorta. This is the left side of the trachea. The left relations contains the part of the arch of aorta, then left common carotid and left subclavian artery, along with the left vagus nerve, left phrenic nerves, and the left side of the pleura. These are the relations of the trachea in the neck region and then in the mediastinum. Now the blood supply of the trachea, the arterial supply is coming from two sources. Its upper 2/3 part of the trachea is supplied by branches from the inferior thyroid arteries, and the lower 1/3 part is supplied by the branches from the bronchial artery. So the trachea is divided into three parts. Its upper 2/3 part supplied from the branches of the inferior thyroid artery. The inferior thyroid artery supplies upper 2/3 part of the trachea. Its lower 1/3 part is supplied from the branches of the inferior bronchial artery. Then the corresponding veins drains the trachea. The lymphatic drainage of the trachea, first it enters into two types of the lymph nodes. In front of the trachea, the group of the lymph nodes are known as pretracheal. Pre means in front. Pretracheal, in front of the trachea. The paratracheal means on the sides of the trachea. These are the paratracheal group of the lymph nodes indicated by purple color. And these pretracheal, the orange color lymph nodes are showing the pretracheal group of the lymph nodes. So the lymphatic drainage of the trachea enters into pretracheal and paratracheal group of the lymph nodes, and from these lymph nodes enters into deep cervical group of the lymph nodes indicated by the blue color. These are the deep cervical group of the lymph nodes. The nerve supply of the trachea, its sensory nerve supply is coming from the vagi, from the right vagus and the left vagus nerves and their recurrent laryngeal branches. The nerve supply for the trachealis muscle, because it is a type of the smooth muscle, so it is supplied by the sympathetic nerves. That's all about trachea. The trachea is a continuation of the larynx. It starts at the level of the cricoid cartilage and its posterior landmark is the C6 vertebrae. And it ends at the level of the sternal angle. The part which ends is known as the carina, where it divides into two main bronchi, the right principal and the left principal bronchus. And it is known as extension of the trachea. It is divided into two parts, the part of the trachea that lies in the neck region, then it extends into the superior mediastinum where it is known as mediastinal or thoracic part of the trachea. Now the bronchi. The trachea divides into two main bronchi. These main bronchi also known as principal bronchi. On the right side, it is known as right principal or right main bronchus, and the left one is known as left principal or left main bronchus. There is a slight differences between these two bronchi. The right main bronchus is much wider, shorter, and more vertical. See in this figure, the right main bronchus is much wider as compared to the left one, which is narrower. It is shorter and the left one is longer. And the right one is more vertical as compared to the left one that lies more horizontally. Then these principal bronchi divides into secondary bronchi. The secondary bronchi also known as lobar bronchi because they supplies to each lobe of the lung. Because on the right side, there are three lobes. So there are three secondary bronchi on the right side. And the left lung contains two lobes. So there are two secondary or lobar bronchi on the left side, which supplies to each lobe of the lung. Now, another difference in the right and the division of the right and the left principal bronchus is before entering the hilum of the right lung, the right principal bronchus give rise superior lobar bronchi, and then it enters into the hilum where it divides into middle and inferior lobar or secondary bronchus. But the left one directly enters into the hilum and then it divides into superior and inferior lobar bronchus. So the differences between the right and the left principal are main bronchus. The right one is wider and the left is narrower. The right main bronchus is shorter and the left one is longer. The right principal bronchus is more vertical and the left principal bronchus is more horizontal. Another difference, the right principal bronchus, before it enters into the hilum of the right lung, it gives rise a superior lobar bronchus, then enters into the hilum where it divides into middle and inferior lobar bronchus. But the left principal bronchus enters into the hilum and then divides into superior and inferior lobar bronchus. Now, each lobar or secondary bronchus divides into several tertiary, also known as segmental bronchi. That supplies to each bronchopulmonary segments. The tertiary or segmental bronchi then give rise to 20 to 25 generations of the conducting bronchioles, and these conducting bronchioles ends as an terminal bronchioles. From the terminal bronchioles, there are several generations of the respiratory bronchioles arises. The features of the bronchioles that they lack the cartilages in their walls. There are no cartilages or cartilaginous rings in their walls of the bronchioles. They are only present up to the level of bronchi, up to the level of the tertiary bronchi. Then each respiratory bronchiole give rise to 11 to 12 alveolar ducts, from which 5 to 6 alveolar sacs arises. These alveoli, they are the basic structural unit of the gases exchange takes place in the lungs. Now see in this flow chart, this is known as a respiratory tree. The successive subdivisions of the respiratory system starts from the trachea up to the level of the alveoli are known as respiratory tree. The trachea divides into two main bronchi, or principal bronchi, right and the left. Then each primary bronchi divides into secondary or lobar bronchi, 2 on left side and 3 on right side, depending on the lobes of the lungs. Then each secondary bronchus divides into and give rise the tertiary or segmental bronchi that supplies to bronchopulmonary segments. The segmental bronchi give rise to conducting bronchioles that terminates as the terminal bronchioles, give rise the multiple respiratory bronchioles. From the respiratory bronchiole, it enters or continues as alveolar duct and forms the alveolar sac or alveoli. Now see in this figure, and again showing the picture of respiratory tree, the successive subdivisions of the respiratory system. The trachea, these are the main bronchi. The right and the left principal are main bronchus. From the main bronchus, these are the secondary bronchi. On the left side, these are the two secondary bronchi. The secondary bronchi give rise tertiary bronchi, also known as segmental bronchi. The segmental bronchi give rise to successive generation of the bronchioles. First conducting bronchioles, then terminal bronchioles, respiratory bronchioles, alveolar duct, and these are the alveoli. The clinical conditions are clinical correlates of the trachea. A term is used known as tracheostomy. The tracheostomy is a type of procedure in which there is a formation of an opening or hole in the trachea. When we use a term stomy means a formation of an opening or formation of a hole in any structure. The tracheostomy, to make an opening in the trachea, this procedure is rarely performed and is only limited to the patient with an extensive laryngeal damage. When there is no any alternate procedure available at that time, then we do the tracheostomy. Or in the infants with the severe airway obstruction, because of the presence, why we have just discussed all the relations of the trachea, because during these procedures, there is a chance to damage the different structures that are related to the trachea, like the carotid arteries, internal jugular vein forming the major vascular structure, thyroid gland located in front of the trachea, the important nerves like recurrent laryngeal nerve. So there is a chance to damage these structures. So the care must be taken during the procedure of the tracheostomy. See in this figure showing the procedure of the tracheostomy, there is a formation of a hole in the trachea and they insert a tube known as tracheostomy tube in the trachea to make a airway pattern. Another clinical correlate known as inhaled foreign bodies. Inhalation of the foreign bodies into the respiratory tract is common, especially in the children. They inhale the pins, screw, or any object that is are twice, and they're stuck into the bronchi. Because the right bronchus is much wider and more in direct continuation, more vertically placed. So the foreign bodies usually tend to enter into the right side instead of the left main bronchus. So usually when there is an inhalation of the foreign bodies, they are more towards the right bronchus as compared to the left one. And the reason is because the right main bronchus is much wider and vertically placed as compared to the left one. So on X-ray, it appears like this. If a patient or a child inhaled a key, so it appears on X-ray like this, and it's more towards the right side. Now, any question related to the topic trachea and bronchi?